Hello, I am Dr. Fonda Goldman, Naturopathic physician, and today I was going to discuss Marma Therapy, specifically the Ayurvedic energy points on the mouth and cheek. So let's get started. Note of caution first, the information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that are severe or worsening, please contact a qualified healthcare professional. It is always important to determine the root cause of any disease and to develop a comprehensive treatment plan. Individual cases can vary in terms of treatments that are most effective, and solo therapies may not be appropriate or effective in all cases. And by solo therapies, I mean only Marma Therapy or only homeopathy. You know, I see people really loving Marma Therapy. They see it effective in some cases, or homeopathy, they want to do homeopathy for everything, but sometimes on its own it's not effective. You have to combine it with other therapies, so just keep that in mind. A few words about Marma Therapy in general. Marma Therapy comes from Ayurveda, which is traditional Indian medicine. The system is over 5,000 years old, and it's a system or paradigm of medicine that's actually considered energy therapy. There are 107 Marma points on the body. So as an energy therapy or energy paradigm of medicine, you know, in this paradigm, you know, people, diseases, states of disease, states of health are all considered different kinds of energy or waves. So just keep that in mind. You have to kind of shift your mindset a bit when you work with this type of therapy. And also, touch, you know, is really there in Marma Therapy to help rebalance energies at different points. So if you come from a background like massage or chiropractic or physical therapy, where the paradigm is usually a little bit more biomechanical, you know, if you press, you know, here you're trying to hit, you know, muscles and ligaments and, you know, joints and that sort of thing. But this is really about balancing and shifting energy. So I'm just mentioning this because sometimes when I try to teach people Marma Therapy, they really are too aggressive with these points because they think if they press harder they're going to get a better effect, and that's not necessarily true, and sometimes you can actually it can be counterproductive. So you really want to use a gentle touch, and most of these points you only really need 30 to 60 seconds, so you don't need to hold them long. And Marma Therapy is non-invasive, so it uses touch only. It doesn't use needles. If you're interested in more history on Marma Therapy, I would check out my first Marma video, Marma Points on the Hand. If you want to see a video where I'm actually demonstrating how to work with the points, I would check out my Marma Points on the Hand follow-along video. And also traditionally oils, natural oils are used in Marma Therapy, so I created a video, Natural Oils for Skin and Body Care, that gets into the whole Ayurvedic system. And actually naturopathic as well. It's a combination of how to use natural oils, not just for Marma Therapy, but for any kind of body care situation. And if you're interested in this kind of content, I'm good at organizing my videos into different playlists, so check out the Marma Therapy playlist, Ayurveda playlist, or body care playlist. So on to the specific points. We're going to be covering 4 points today. First point is called Oshta, which means upper lip or self-expression in Sanskrit. And the location of it is the midline of the philtrum, which is the little divot between your nose and your upper lip. And it's about 1/3 of the distance between the nose and the lip. So the energies balanced by this point are the Pranavayu, Udanavayu, Pachaka Pitta, Tarpika Kapha, and Bodhika Kapha. And as I've mentioned before in my videos, this line here with the energies that I mentioned, it's not essential, but if you are a deeper student of Ayurveda, it really helps to organize your mind around what kind of energies are balanced. So as you learn more about Ayurveda, you probably want to include this information in your mind. So this point Oshta is actually indicated for things like different states of consciousness, fainting, alertness, vertigo, even coma. It helps with cerebral circulation, right? Because you're basically very close to the midbrain here. So it can help with things like cerebral ischemia and hypoxia. It can help with things like concentration, ADHD. It can help with headaches, seizures, facial nerves, so problems there like Bell's palsy or trigeminal neuralgia can be helped with this point. The face in general, so most of these points, because they're on the face, and all Marma points have local effects. Actually, there are, like Ayurvedic Marma point facial, sequences that some people use, and it's more for sort of aesthetic. So it does actually help with color and complexion of the face. It's right there below the nose, so it does help with some nose issues such as bleeding. And it's right in the middle of the top incisors, so it can help with toothaches. But again, as I mentioned in the note of caution, if you have a severe toothache, then you want to go see a dentist. Don't avoid that. Marma therapy isn't necessarily going to help you if you have a deep nerve root that's infected. You really need more help than just Marma for something like that. It can help with things like speech disorders. So if somebody, like, especially, it could be, children or adults, but if they have problems with speech disorders, and disorders originating from the mouth, not necessarily from the throat, but things like stuttering, aphasia, dysarthria, and maybe they're going through speech therapy, this sort of Marma therapy can be combined into a treatment protocol for a patient. It also helps with GI, so especially enkindling Agni, and Agni means sort of digestive fire. So if you feel like food isn't moving through your system very well, or you're not digesting things well, working with this point can be helpful in that regard. Point number 2, and it's a pair, it's called Chibuka, which translates to kiss or prana, vitality of the mouth. And the location is just really like half a finger angularly outside the angles of the mouth. So again, a pair, one on each side. And the energies that these points help with are the pranavayu, the apanavayu, and the bodhika kapha. Bodhika kapha, just as an example, again, I'm not going to get into this. I'm probably going to make other videos getting into the subdoshas. But bodhika kapha is especially the sort of moisture, liquid, salivary, sort of environment in which the mouth, that the mouth creates, like to help with digestion and help with taste and things like that. So that's bodhika kapha. Indications for these points, the mouth and jaw, so things like salivation, too much or too little, TMJ, because we're getting close to the joint there, temporal mandibular joint dysfunction, and again, some toothaches. Mild, again, don't forget your dentist if that's needed. Facial nerves again, like Bell's palsy, trigeminal neuralgia, the face again, color and pain. And also it helps with GI, so again, lack of appetite and digestion because you don't have enough digestive fire, Agni. And these points can actually be helpful with sexual dysfunction, so things like impotence, problems with the ovaries and the testicles. And if you can actually use some Marma points as diagnostic tools as well. So if you find a groove, the groove that kind of can develop, very strongly, you can kind of get a deep groove between the nose and the corners of the mouth. It's possible, not always true, but it's possible that this could be an indication of dysfunction, especially regarding the sexual organs. But, it might be because you lean on your face or you sleep, on your side, on the same side or something like that, or you sleep on the side and your face gets pushed into the pillow. So again, always determine the root cause. The third point is Hanu, which translates to chin. It's on the midline and it's in the depression between the lower lip and the chin. The energies balanced by this point are the apanavayu, sadhaka pitta, and bodhika kapha. So local pain, and again, incisor pain and temporal headaches are helped with this point. The posterior pituitary gland is helped balanced by this point. Again, problems with the mouth and jaw, salivation, too much, too little, salivary glands, drooling, incisors, TMJ. And again, facial nerves and face in general, so color, tone, and Bell's palsy, trigeminal neuralgia. That's going to be true, actually. The facial nerves and face, all the points mentioned today help with these things. This point, again, this is kind of unique among the lip and cheek points in that it's really good for stress and emotions. If you're interested in learning more about Ayurvedic psychology, I've created a video on Ayurvedic psychology, so you may want to check that out. But just very briefly, so pitta or fiery type of emotions include things like pride, courage, too much or too little, like being anger, self-confidence, again, too much or too little, being overly confident or underconfident. Vata type emotions, including fear, grief, loneliness, sadness, and kapha or earthy type emotions, including attachment, greed, and melancholy. This point is also particularly good for functions, lower body functions, such as the lumbosacral area. So if you have lower back pain, it can be helpful there. But again, you have to figure out what's really going on with the lower back. If you have bad biomechanics while you're sitting all day in front of a computer, or if you have shrinking discs, or if you had an injury and it's through the spine out of alignment, again, all you need to figure out the root cause. And again, Marma Therapy can be helpful, but Marma Therapy isn't by itself is not going to straighten your spine if you have an asymmetry there. So it can also help with lower body functions regarding the colon, so things like dysregulated stool and hemorrhoids, sexual function again, dysfunction also represents the cervix, prostate, and testicles. And again, some people have a groove here, and that may indicate, again, possible, not always true, it may indicate dysfunction of especially like the cervix, prostate, and testicles in people. But just because somebody has a groove here, don't assume that. You have to check it out. But it might give you a clue that something might be going on in other areas of the body. The last point here is Kapala Madhya, and which means middle cheek. Madhya, again, that's a descriptor that comes up in a lot of these Marma points. I discussed it in my first time I mentioned it. Some of the terminology was in my eye video, so you can check that out. But the location of this point is the center of the cheek between the maxilla and mandible. It's a pair, one on each side. It's at the midpoint of the anterior border of the masseter muscle. And what you can do is when you smile, you just kind of follow like the line of how you smile, and you'll kind of come to a natural stop because you get, you kind of run into the masseter muscle and the TMJ joint. So basically the middle of the cheek there. The energies at this point, and again, it's a pair, so there's one on each side. And the energies balanced by this point are the Panavayu, the Samanavayu, the Pachika Pitta, the Bodhika Kapha, and the Kledika Kapha. Indications, again, local pain as all Marma points. So, and remember that too, if you have some kind of dysfunction going on somewhere in the body, you always want to look, so that the points closest to where the problem is. And then, maybe find some other ones, but, always look close to where the problem is first. So problems with the mouth, again, salivation, too much, too little, helping to digest carbs, because you have the amylase in the saliva, right? Amylase is an enzyme that breaks down carbs. And again, mild toothaches, facial nerves and face, again, Bell's palsy, trigeminal neuralgia, color, complexion. Problems with the cheeks, so the parotid gland, mumps, TMJ, and ear problems because, again, we're getting close to the ear, so ear disorders and problems with the eustachian tube. But again, if you want more differentiation with Marma points regarding the ear, then I would check out my ear video, Marma points for the ear video. This point also helps with GI, so it enkindles Agni again, digestive fire, which helps to improve digestion and absorption. And it also helps with the colon. So things like loose stool, ulcerative colitis, and pain in the colon. The point on the right cheek corresponds with the ascending colon, and the point on the left cheek corresponds with the descending colon. So if you know specifically where the issue is, you might work with one point a little bit more than the other. So again, I like to always, at the end of my videos, I always summarize the points so you have a chance to integrate the information. So as a summary for the mouth and cheek points, again, local effects. All of them, all Marma points have local effects. Consciousness, cerebral circulation, concentration, ADHD, headaches and seizures, all point 1. Headaches also can be helped with point number 3, Hanu. Hormonal function, again, 3, Hanu. Stress and emotions, Hanu. As I mentioned, general face, sort of aesthetics and facial nerves, all of these points. The nose, 1, it's closest. Mouth, jaw, teeth, all of them. But if you want specifics, I'd go back to the previous slides to really, if there's like a certain thing, certain infirmity that you're looking at, you can look at the slides individually. The cheek, number 4, because it's closest. Ears, 1 and 4, those are going to be closest to the ears. Speech, 1, and again, speech disorders related or originating from the mouth, not necessarily the throat or the trachea or something like that. Digestion, all of them, but again, digestion, is it the upper digestion like the mouth, or is it like the lower digestion, like just general appetite, or like the colon? So again, check back on the previous slides for specifics on that, but all of them help with digestion to some degree. The lower back, point 3, Hanu, is kind of a unique point for that. In sexual dysfunction, points 1, 2, and 3. So the ones right around the mouth, not necessarily the cheek, but the ones right around the mouth are helpful with sexual dysfunction. So there you have it, points, Marma points around the mouth and the cheek. Hopefully you found this helpful, and again, I'm rolling through, video by video, all the Marma points on the body. So thank you for your time, and until the next one, take care. Namaste.